Well, I was just saying, I say thank you to you, and I say to all those listeners that you have out there is to be careful, to listen very carefully to this man, because he not only knows about health of the body, but health of the spirit and health of the mind. You put it together, you got one heck of a combination.
I, Ahmed Malik, am a private civilian protected by the Geneva Convention. My Substack, social media posts, and podcasts are my personal experiences, observations, and opinions. This information is for educational purposes only. Although I am a doctor, I am not your doctor, and I am not providing medical or legal advice to you or to the wider public. I am not licensed or registered with the GMC or any other licensing board. The responsibility for the interpretation, due diligence, and use of the information from my Substack and my podcast lies with you, the viewer and or listener. Please do your research and use your discernment. It is not my intention to harass, intimidate, offend, defame, conspire, blackmail, coerce, or cause anxiety, alarm, or distress to any man or woman, and the information presented here is done so with peaceful and honourable intentions. Enjoy, folks. Right, Melissa, thank you so much for joining me. Nothing changes, we're just having a chat just like we were before. Although some of the stuff I wanted to say to you off air, I'm not going to say now. I just wanted to get stuff off my chest. But basically, it's funny. I've actually got a schedule for my podcast. I'm fully booked till the middle of December. I've got all these recorded podcasts already. And, doing this podcast is putting a bit of a spanner in the works. It's going to set everything off like a domino. But it's not just you. I've got Liz Evans coming on. I've got the MLP Phil, what's his name? Frew. And I've got your solicitor, Michael. And the reason why I'm getting these 4 podcasts on board is because of an interview you recently did and a piece that was written by Liz Evans, Dr. Liz Evans, highlighting this Northern Ireland consultation for a health bill that's being proposed, changes and amendments to a health bill, which on the face of it and on further scrutiny are the most horrific violations of personal freedom and are the most dystopian things you can ever imagine. And I really want to get the message out there to people, and there's an email that you can write to and say, no, you don't need to be a citizen of Northern Ireland. You don't need, because anyone who travels there, works there, can be affected. But also the precedent, if this comes through in Northern Ireland, it's going to be England and Wales next. And then the domino effect keeps going on and on and on. It's all about basically this attempt, like you've written, you've done so much work on this, this concept of protectionism, bringing it in through the back door of public health. But what it means is giving up on informed consent, bodily autonomy, and giving them the powers to surveillance and so much more. So look, I've done a little intro. Tell me, what have you discovered? And let's just start dissecting all of this shit show.
Well, let's start at the end. What do they want? They want a one world government. So in order to get a one world government, you have to have a world problem. You can't have something that's regional. So that's why they chose pandemics, and then they can merge that into climate and cyber attacks. So if you now start to view this bill through that lens, then you can pull out what's actually in it. So it's an idea of forced protectionism. So the only reason that everything worked over the past 4 years is because people were scared about their health or their loved ones. So now they plan to introduce this forced protectionism that if you don't accept medical protection, you can be criminalized. That's the gist of what the bill is about. In my opinion, it's to extend that then to surveillance, because Mike Nesbitt does say in his introduction that then they can introduce an all hazards approach to enable broader surveillance. So now if you've given up your bodily autonomy in order for this forced government protection, well then you can extend that then to surveillance. You give up your biometric ID and your right to privacy in order to be protected from crime. And then that will extend towards the economy, that if you just give up your financial autonomy, then the government will protect you from all things. This is all because they know what's happening within the economy and they're scrambling to get something in place to control everybody. But this one is public health hijacking everything. Mike Nesbitt, the Minister of Health, will be top dog in Northern Ireland because should there be an emergency, he can move in and hijack even the way the magistrates' courts work, the way the rule of law works, and force people into taking vaccines. It literally says that you can't be forced to take any medical treatment except for vaccines and prophylactics.
Yeah.
In none of it does it say there needs to be any group benefit.
Yeah. Yeah. So, look, when I grew up in Glasgow, in a rough area at the time called Drummoyne, it was next to Ibrox football stadium where Rangers used to play. And I remember as a kid seeing the other kids in the street go up to people who were parking the cars because, when the match was on, there were so many cars parked on all the streets off the main street and everything. And so you'd have all these cars and people coming from all over the place. And these little kids would be like, do you want us to protect your car? If you give me 20 pence, 10 pence, I'll look after your car. Stop it getting scratched. And if people said no, it was the same kids who were offering the protection who would scratch the car. So when the people would come back, they'd be like, oh, for God's sake, my car's being scratched. So the next time they'd come, they'd be like, all right, here you go, 20 pence to the little kids. They were running a racket. The people that were offering the protection were the same people inflicting the crime. And I think the government is no different from that. Whenever the government comes to you saying, we're here to protect you, what they're actually saying is just like what the mafia does. We'll protect your shop and your business. But if you don't protect us, well, my goons might come round and knock it up a little bit, and knock you up and rough you up. And it's the same people. And the government essentially is a racket. It's a criminal syndicate running a racket. And this bill, to me, exemplifies that. Would you agree?
Yeah, it's legalised racketeering, that they can disregard the rule of law. They can just create an emergency and disregard the rule of law, disregard your human rights. In a way, there can be a party argument against this because they can say, well, is it a human right that you have freedom of travel? Because if we all agreed to negate those human rights during the lockdowns, well, then couldn't it be argued that they should no longer be a human right if we agreed because we were paid to pretend that we no longer had those human rights? And they want complete control. This, for me, it's, again, I said it with the vaccine passports, there were data passports. So this is a way to get complete control over the economy. How do you do that? Well, their ultimate goal is CBDC, but before that, they need digital ID. How do you get digital ID? You do it through healthcare, and that seems to be the way it is. We have the Encompass programme here in Northern Ireland. It was introduced in the UK in 2014. Absolute failure, people not getting emergency care, letters not being sent out. It's been brought in here in 2020, in June 2020. It was a priority to bring that in here, and it's your digital ID for access to healthcare. Absolute failure. I think nearly 80% of America is using it. Why do they use it? Because it actually links to the billing to your insurer. So they know that NHS is in shambles. They seem to be offering up a honeypot of data to the likes of Epic, who it's their software. Sunak paid Palantir, I think 330 million, to have all our medical data, and they're CAA funded. So they seem to be near selling our data while Rome burns, and trying to get as much government control in the meantime over us. And that's what this bill is. If you look at it's been brought in Scotland. I think it reached Royal Assent August 2022, the Coronavirus Reform Act, something like that. In that bill, what I noticed is it mentions court 91 times and health 70. So now you get the structure of what it's really about. It's the same as all done under threat of fine or jail. Same as but they want to legislate on what they did, which was completely unlawful. And I know that you're having Michael Brentnell on, and every case that he has took against what was done during the lockdown has been found to be unlawful, and he's won those cases. But now they want to make them lawful.
Oh, look, we're going to go into the details, and the problem is it's all in the details. And for most people, including me, it's quite hard. I read the legislation, and after like 2-3 pages, you start getting a headache, and I feel like I got good attention span. But someone like me struggling, I mean, God knows, what other people are like. It's just hard. It's hard work dissecting it through. But in essence, look, it's tyranny masquerading as protection, and it's health protection when it's really medical enslavement. I'm just going to show you a few things. I'm going to share the screen, and we just talk about things from there. So basically, you've got this Mike Nesbitt. Mike Nesbitt is, for those who don't know, he's a Northern Ireland politician. He's a former broadcaster, and he's been serving as a Minister of Health since May of this year. He's been the leader of the Ulster Unionist Party since August 2024. And he's got no medical qualifications, and he's not a medic, but he is the health minister. So I mean, this man is clearly not the guy who's getting the advice. He's clearly getting it from this guy here, who is the chief medical officer. And in the United Kingdom of Great Britain and Northern Ireland, you've got 4. You've got the England chief medical officer, Wales, Scotland, and Ireland. And they all meet regularly. They all know each other. They're all chums. And he must be giving the basis of advice, this chief medical officer, about what to do and how to harmonise everything across all the different countries. But also, I just want to show you, you talked about the Scotland bill. I've got the Scotland bill. Here it is here. So this is the Scotland Bill, Coronavirus Recovery and Reform Scotland Bill, 2008 modifications. And in it, even back then in 2020, whatever it was that was done, they talk about special restrictions and requirements. And in the original bill, it's very non-specific. It's just, it says regulations under section 86A1 may not enable the imposition of a restriction or requirement by virtue of section 86.4, blah, 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 blah. Anyway, and then it says may not enable the imposition of a special restriction or requirement. And this is not defined in the original bill. But then in the latest bill, they talk about, well, a special or restriction or requirement means the falling from 2 to 5. And this is what gets really scary. So in Scotland, they had passed this. A person will submit to a medical examination, be removed to a hospital or other suitable establishment, quarantine. They can be detained in a hospital or other suitable establishment. So taken away from your home and put in a hospital or quarantine? For how long? Be kept in quarantine. Be disinfected or decontaminated. How? Be forced to wear protective clothing. What? Mask? Hazmat? What does that mean? Provide information or answer questions about the person's health or other circumstances. Has the person's health monitored? That's surveillance. That means blood tests, means whatever, tagging, tracking. Attend training or advice sessions on how to reduce the risk of infecting or contact. So you'll be sent to re-education classes. Reprogramming. You will be subject to restrictions as to where the person may go or with whom the person has contact. You might be told to just stay in your house. You can't even meet your family. Can't meet your wife or your husband or your children. And you'll be abstained from working or trading. And it goes on. They talk about things like you might have a thing. Who knows what that thing is? But it might be seized, detained, kept in quarantine, disinfected, decontaminated. It might be removed. It might even be destroyed or disposed of. Your premises might be closed. Your vehicle might be taken away from you. In the case of a building, structure, mobile home, or vehicle, the premises can be destroyed. I mean, if this is not fracking terrifying, I don't know. And I think you talked about it off air with me earlier last week, where they've cookie cut, bits of the Scottish bill into this new legislation. But in essence, like, we will get into things, but we're talking about detaining and quarantining individuals for up to 28 days. And I'm using Liz Evans' article to help me with this one. Mandating the wearing of medical clothing such as face masks, forcibly entering premises, and confiscating belongings without a warrant. And in the bill, this Northern Ireland bill, it talks about agents of the Northern Ireland public health, who officers, or anyone that officers have designated, any one or many individuals. So people can literally pitch up at your doorstep, break down the door, drag you out, take things from your house, examine things without a warrant. They can require your children to be kept off school. They can close your businesses and keep adults off work. They can breach medical confidentiality and privacy and share your data with with patient medical information with various state bodies, which may or may not be working for the government, directly or indirectly. Require an individual to answer questions regarding their health status. So there goes medical confidentiality. Require a person to attend training or advice sessions, just like we've just mentioned with the Scottish one. Legislate as to where the person may go or with whom the person has contact, just the same as the Scottish one. There goes your freedom of movement. There goes your freedoms. I mean, when I read this, Melissa, I'm like, are we kidding? Like, is this real? I mean, seriously, is this real, Melissa?
It is real. It's already in Scotland. There's Bill C-293, very, very similar to that, that's currently in the Senate in Canada. And they almost got it into Northern Ireland without anybody knowing about it. It only came to my attention. All MLAs, the Bar Association, civil servants, etc., have had this from July. Nobody's really sounded the alarm. All they ever had to do was publish page 47, which is everything that you've just mentioned, and then tune into people that page 47, and I think it's around page 7, it's from 86D onwards, I think, in the Scottish bill, are practically word for word in what they want to do. And they also say detainment and isolation. Isolation's different than detainment. That's when they remove you. So if you're a mother, how does that affect your family if you have 3 kids and one decided to be put in isolation? They haven't identified what tests they'll be using for this. They haven't even specified. They want to move this to an all hazards approach. But what is all hazards? How do you define it? Could that be a climate emergency? Could it be economic instability? Could it be power outages? And within this bill, it also says the public health one. We don't know what department that this would be dealt with. Public health will step in. In terms of the thing, they actually tell you what the thing is. The thing is dead bodies. Imagine having your loved one who has passed away referred to as the thing. In that circumstance, if they're deemed to be unclean, you have to put signs around your house that nobody can come in. That is up to you. The other thing that the thing is that when I first read it,
oh no, I read that. It says the thing can be a dead body, but a thing could be anything. I think pets.
I think it's
equipment. Could be anything.
But agricultural animals, or so therefore, then they can take control of the food supply and destroy the entire food supply if they decide that there is a threat. Now, we have Chris Whitty coming out and said that they overstated the risks of COVID. But he also says that he is certain, he can say with certainty that there's going to be another pandemic. And they have the same data that we have. They were the ones that didn't obey any of the rules. And Cathy Gray has put in freedom of information from the start. And in the entire 4 years, she just got another recent one back. In the entire 4 years since it started, 275 people, 277 now, have died in Northern Ireland from COVID. And that even includes, I think, pneumonia is in with that. So they have destroyed the economy, they have destroyed the mental health of children, destroyed the education of children. And they want to legislate this outreach. Now they have that data. And anybody who was questioning me, she was sending it to their office. Danny Donnelly said that there was misinformation, and she sent that to the office. The other information that she has is that 58 people have 58 deaths and reported deaths, and I think 5,166 around that reported adverse reactions from the vaccine. Now that's only the reported ones, and we know that stands anywhere between 2 and 10% at best. They're saying that we've learned lessons from COVID, but they haven't learned any lessons. They're not waiting to learn the lessons. They want to legislate in these powers, because what they don't want is to protect the people in any capacity. They want state overreach over the people because they know what's coming. So it's safety. It's a pretense of safety to justify.
It's the inversion of reality. Absolutely, it's the inversion of reality, and it's so desperately sad, to hear that. It's just, it's sad that those 400 people died, but when you put it into context with people die every year, that's nothing new. And how many people die of pneumonia? How many people die of car accidents? How many people just die of suicide? I mean, we shut down economies and, like you said, ruin children's lives and adults as well, and the mental health and the financial repercussions. This will last us generations. For what? For honestly, for nothing. There was no proper risk assessment, and they know this. And yet, instead of like Chris Whitty saying, we overstated it, and reeling back and being apologetic, and they're just ramping it up. So this is the bill. This is the consultation bill that you're talking about. And just for clarification, if people don't know what MLA stands for, it's a Minister of the Local Assembly in Northern Ireland, and they have the same powers as a Member of Parliament. So these people have got a lot of power because Northern Ireland is devolved. So they have a lot of power in Northern Ireland. So this is the bill that they're talking about. It was issued on the 5th of July. If you go to page 47, we can see where they cookie cut the stuff out from Scotland. The regulations impose restrictions or requirements or in relation to persons, things. This is what I meant. Things. That means objects or premises. In the event or in response to a threat to public health, or enable a Northern Ireland department, the regional agency, or another person who's that, by virtue of decision taken under the regulations to impose such restriction or requirements. That's unlawful. You cannot do that. You cannot impose them without my consent. In relation to a person, the regulations impose a special restriction or requirement, such as, and it goes here, requiring a person to submit to a medical examination. And that might be, taking your temperature. It might be innocuous as, just taking your blood pressure, but it might be a rectal swab. It might be a blood test. It might be something else. Be removed to a hospital or other suitable establishment. That's taking you against your will to, imprisoning you. Be detained in a hospital. And note, no time frame. Again, keep you in isolation. In isolation. So, Melissa, I know you know, but just the most severe form of punishment to a human being is isolation. When you've got prisons, high-risk prisons, and you've got all these murderers and all the rapists and everything, when you say to one of them, you misbehaved, we're going to put you into isolation. These badass, evil people, they're not terrified of being out with other rapists and murderers. They're terrified of being on their own. Isolation is the worst form of punishment. It psychologically breaks you. It's horrible. It physically breaks you. And you're talking about keeping a person in isolation. Require a person to be vaccinated or to receive other prophylactic treatment. So hold on, you're going to forcibly inject someone against their will potentially? And what does that mean, prophylactic treatment? What, intubating them? Giving them remdesivir? And it just goes on and on. Everything we just talked about. And in relation to a thing, and this is what I meant, Melissa. So it says, in the case of a dead body. But it doesn't say what the thing is. There is actually no definition of what a thing is. The regulations may impose a special restriction. So they can seize your equipment. They could seize my podcasting equipment. They could seize my laptop. Who knows? Because you know what? It might be infected. It might be a cause of, it could be a public health harm. Me disseminating knowledge could be harmful to the public health. And it goes on and on. I mean, it's kind of terrifying. And in here, there was a section on all hazards. And I think that's important that you'd mention that, because all hazards, there is, again, no definition of what a hazard is. What do you mean by that? Like, you know, so, and when they talk about these public health contaminations or infections, they're talking about potential as well. So it's not even that something is out there causing harm and death. Something that potentially might cause it, you know, ignites this process and gives these powers to the authorities. My brain just can't handle it. It's so dystopian.
Well, it's actually if you are or may be infected as well. So that would indicate that they're planning to use. We thought that they wasted 37 billion in contact tracing. Obviously, they plan to enact that, because in terms of the court, it's if you may be infected. Well, what does may be mean? If you've been in the vicinity on somebody, and that would be further indicative when they talked about the schooling. That if there's an issue with a child at school, they have to have the names and addresses of all the other children. So theoretically, if a child goes in and sneezes and they test that child, the child's positive, maybe they have other siblings in the school, or maybe they've been into the lunchroom, so the school would need to close down. But then does that extend out into the parents? Would they all have to test? And you could close down the entirety of Northern Ireland within 24 hours based on this. For they're saying 28 days, but then when you know, they also can destroy your business. They can come in and take electronics. This is back very much to the hate speech. So the process then becomes a punishment, because if they come into your house and they take my 2 kids' laptops, their games, their phones, PCs, you're talking minimum £10,000 to start to replace all that. So what I think, it seems to me that what happened here, so yes, there was court cases won. They did act unlawfully, but that took a couple of years to come to fruition. So if they enact this, the hope is that people will be so scared by the time it's challenged, because this will be challenged, because this is moving into secondary legislation, and it's trying to usurp primary legislation because it's an emergency. So it will be challenged in the courts, but what, for in 2-5 years, so that everybody is completely compliant and on board with moving us all into socialism / communism, because it's where the state take control of everything.
Can you just explain to me the difference between primary legislation and secondary legislation?
Well, it depends how it has to be go through a process in order to become primary legislation, where it's challenged, etc. So primary legislation will always be ahead of secondary, because it's gone further down the line. But they want to kind of hijack that. It's a backdoor into hijack. What are the laws? Like changing the rules of the magistrates' court, like if they change the rules of the magistrates' court, where you don't get the right to be there, they can have a court order against you without you having the right to be there. Now, under Article 6, you have the right to, it's not just a free trial, it's the right to face your accuser, the hearsay and test the evidence. Because in that scenario, the burden of proof is on them to prove that you are a harm or a risk. But if you can't do that and you can only appeal, now the burden of proof is on you. And that's not how criminal law works. It's also saying that there can be all hazards, no harm. Criminal law does allow for an element of harm as long as it's consensual. The way it was explained to me is husband and wife can brand each other. That's harmful, but there's risk involved, but because it's consensual, the law doesn't step into that. They want to step into every aspect of your life with an all hazards approach to harm, because they know that the harm is going to be financial further down the line. They can also come in and destroy your property if it's deemed to be unsafe, infected. There's something similar with the Canadian bill where they can expropriate your property or the use, if it's deemed to be better used during a pandemic. So now they're taking away the idea of bodily autonomy. They're taking the idea away of property rights. So they're slowly conditioning you to accept that you don't have any of this, but you will accept mass surveillance for control.
But that's exactly what communism is. You have no private property. You have no control over your body. The state has all the power. And, here in the UK recently, I don't know if you know, but it was in the press and everything. Keir Starmer was, out there. The state will take back control of people's lives. Take back control. Let's just say, just forget that we'll take back. The state will control people's lives. And this is recent, 24th September. And this is what we are up against. We are fighting this evil. And let me just find this. Nope, this one. This is going back to the bill that they're proposing on page 26, 63. It says, it is proposed to include an offence of willful obstruction to the effect that a person commits an offence if the person willfully obstructs any person acting in execution of the above provisions or of a warrant made or issued, a person guilty of an offence liable on summary conviction to a fine not exceeding level 5 under standard scale £5,000. If you just go above it, every warrant issued under these provisions will continue in force until the purpose for which the entry is necessary, which has been satisfied. A provision will also be included in the bill to the effect that nothing in the power of entry provisions or the supplementary powers will limit the other parts of the bill or regulations made under it. Basically, look, they will be allowed to enter your building with or without your permission.
Yeah.
And if you obstruct them, if you say, no, you're not allowed to come in my house. You can't come in my house. That's obstructing. They can put handcuffs on you, take you to jail, charge you £5,000. I mean, this is evil. This is absolute evil. And I was speaking to Debbie Evans at UK Column, and she was talking about the fact that they're also bringing in legislation where, that will affect if you rent a property or you own a property outright, or if you have a mortgage, which basically covers all of us. If you fall into any of those three categories, so I'll repeat again, if you rent a property, if you own a property outright, or if you have a mortgage, they will put conditions on that property so that it is compliant with climate change agenda. So if it doesn't have a heat pump, if it doesn't have solar panels, if it isn't insulated in a certain place, they can take that property away from you. You heard it, guys. They can take that property away from you. And this is again like the bill is saying. This is what they're doing.
They plan to tax your property out of your ownership. They're not going to, people think that they're just going to come and take it. They're not going to come and take it. But what it'll be implemented through green finance. So say that your house, and the majority, I think 90% of the housing stock here wouldn't be above, can't get to even category C, because most of it's built after or before 1990, the housing stock here. So they know this, so that if you know that they're not going to meet these higher categories, then what you do is you tax people. So your council tax will be based on what your bracket is. The heat pumps, I've looked into them. They're energy vampires. They're not financially beneficial to anybody. But they keep on taxing and taxing you. They can tax your own your property out of your ownership. So this is where they're moving towards. They want to own everything. They've told us they want to own everything. They're not going to take it direct. But if you are older and you have to pay these taxes and you're not working anymore and you have budgeted for retirement, then maybe they'll put a lien on your property when you die, that they'll own it when you die. And if we don't stand up against this is, I think I've read that they're also going to start taxing further taxes on cars, so that you'll not be able to own anything because the tax on it will be so high. And they know that it's all based on absolutely nothing with the climate. Even network heating doesn't work. None of what they're introducing works. And we don't have the provisions. It would be fine if you were just flattening Australia and building in the middle and starting it all that way. but we don't have that provision. So it's not about tax. And that's also about my thesis about central bank digital currency. People are not asking why. Yes, there's the level of control. But with inflation, that's how they're using their funding. So inflation at its core is a tax, and it's predominantly a tax on the poor. But they know that that is running its course. So now they need to move into more direct taxes, and they plan to get ownership of everything in the meantime and move you into a subscription economy. And then when it's CBDC, every transaction becomes taxable, and they can tax you whatever you want because you don't have alternatives in order to fund this big government. And the solution is to reduce the size of government. But reading this, you can know what they anticipate is coming. If they feel that they need this level of overreach, now they're trying to get it under the guise of public health, but you can see what it's actually about is a move towards surveillance and controlling the property, and you being psychologically conditioned to accept this and accept that if you accept that you don't own your own body, well, it's a small step to say that you don't own any possessions.
Yeah,
and
100%.
it's really time for people to. This is the time to act. For me, with this, people are saying, so I've told people, contact your MLA regarding it. The MLAs are given a cookie cutter response, generic response of, oh, don't worry about it. This hasn't even reached the assembly floor yet. It won't for a couple of months. When it does, it'll be debated, etc., etc. Well, when my kids were young, I taught them, if anybody ever tries to get you into a car or grab you or anything, fight. That's the time to fight. There, kick, bite, scream, do everything that you can, because when you're moved to a secondary location, then it becomes really difficult to fight. So for the people that are completely opposed to this, which I think is probably 95% of people, now's the time to fight. The secondary location will be within the assembly, and I don't want them to make the right decisions for us, because they're telling us that they don't trust us. They're saying, we don't trust you to do the right thing, so we're going to have to put it into legislation. And the truth is, during the pandemic, so many people were scared, and they did act with empathy and kindness towards each other, and they did do the right thing. The people that didn't do the right thing were those in Downing Street. They didn't do the right thing, and they had all the information, but they're telling us that they don't trust us to do the right thing. So I don't think that we should then trust them. This needs to be taken down now. It can't pass consultation, and it isn't a meaningful consultation.
I know, we'll come to that in a second.
Be,
We'll come to the consultation in a second, but let's just go back to the properties, right? So I live in a 300-year-old house, and it's still standing, right? And when we were buying the house, 10 years ago, whatever, the surveyor came around and said, oh, this thing is not right, and that thing's not right, and this isn't right. And I was like, oh, bloody hell, man. And he went, look, I have to say this, but the reality is it's been standing for 300 years. It's going to stand for another 300 years. And I spoke to a property developer recently who wishes to remain anonymous. And he said that there's no money in property development. And the vast majority of property developers are just building shit houses that will probably not even last a 25-year mortgage. They're built in such a way where there is no air, breathing in the building. The building doesn't breathe. It will get damp. It is made of really poor quality materials, all synthetic, unnatural, and it's not really fit for human life. But it ticks all the boxes that the government applies now as to what a building should be like. The building regulations and climate change, net zero and all that bullshit. But the thing is, these buildings are toxic environments for human beings. But the government wants all these buildings built like this. And with these, what the government wants is for people like me to modify my house, my old house, and they don't have to be as old as 300 years old, but even 100 years old or 80 years old. These buildings were built to last. They have to be modified, and because it can't be modified, we will be punished for that, taxed out of our own homes. And it's so, the inversion is so awful because these homes are actually sustainable. They're built to last. They're built with materials that are natural. Oftentimes, I've got lath and plaster, or whatever it's called. And it's great. It's not just a concrete, toxic chemical box that I'm living in, but they want us living in toxic chemical boxes. That's their idea of meeting the climate change narrative and whatnot. And it's just evil. It's evil. And it's simply because they want to take our homes away from us. So they're creating the rules and the goalposts. They keep moving the goalposts, and they move the goalposts and make them absolutely tiny that the ball can't even pass through the goalpost. And that's the power that they have, that they can use words and legislation and twisting reality and truth so that they say one thing when they mean the exact opposite. So it's not about the environment. It's not about climate, because climate is a scam. They use these things as a pretext to take away our freedoms, our liberty, our property, our money, our wealth, our hard earned, labors, fruits of our labors, what little we have left after taxation. And now this legislation is the same, and it's so evil. I can't stress it enough. I'm just going to go back to it. I just want people to see, right, this bill, right? So ministers forward, and this is what I mean. The tool the enemy uses isn't just bombs and missiles and guns and heavies. It's words. And it's always done in a way that sounds nice, and it's very wordy and it's very technical, and you just get bogged down in management speak. And it's 79 pages. And it talks about how this is a second consultation on public health, and it seeks your views and specific policy proposals that will underpin the provisions to be included in the bill. The first consultation came in September 2015, asked basic questions about current public health law. The outcome of that consultation enabled a final report to be published in March 2016, which set out key recommendations for legislative reform, blah, blah, blah. And this is what I mean. It's just word salad. It goes on and on and on. In the background, talks about the Public Health Act in 1967. It's now 56 years old. And, because of COVID, blah, 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 the team will be bringing forward a new legislative framework which would be limited in scope to health protection, which is the prevention and mitigation of the impacts of infectious diseases, environmental, chemical, and radiological threats on individuals, groups, and populations. It goes on and on and on. And this is the point that you meant. In summary, it is proposed that the new bill will be based on the all hazards approach in alignment with other UK jurisdictions for the protection of people from known or yet to be discovered hazards, infections, or contamination. Update certain powers around restrictions on employment, quarantine, isolation, and medical examination. And the thing is, at no point, Melissa, am I right, did they explain what all hazards mean? And it's like,
and it says all hazards, infections, or contaminations. So all hazards isn't then included in infections or contaminations. So they're not saying what all hazards is. So it could well be climate related. So it's just another way to get in control, government control, because they know that the monetary system is failing, and it's going to be very, very difficult for them to control us when people realize. What do you think the people are going to realize when there's no back into any of this?
Yeah, exactly.
The is backed by faith in a bank ledger system, that the economy has become so increasingly financialized, where money is made from money rather than any production. And that house of cards, so they've built a house of cards. So there's a real asset, and that asset has been bet against, borrowed against, insured against, and so on. That's what's broken. That isn't free fall. So they're going after the real assets. They need to own the real assets in order to control everything. So that is including our property, but it's also us and our sweat equity that we have to offer. So they're trying to get control over that because they know this house of cards. It broke in 2008. It was incapable of ever being fixed. And in 2019, it broke again in September 2019. And this is what led us to this. That's why they're going after the real assets and trying to control the population, walk them into accepting that you don't own anything, including your own body. And that's the first. If you can get somebody to accept that, then it's easy to get them to accept anything else after that. And totalitarian control, it will make China look like Candyland.
Absolutely. Absolutely. The thing is, how dare they? How dare they? Who gave them the authority to change our healthcare system and the way the magistrate courts work? Who gave them the right to take away our freedoms? And again, all in their lying way, they state it's for our protection, and it's absolutely not. And I read another section, I was struggling to find it, where they said, if you basically protest, if you gather together as a group, they can come and remove you. So that removes our right to protest, and our right to gather. These are fundamental rights that we have. So movement, getting together in groups, protesting, the right to live and have bodily autonomy. They want to remove all of that. And instead of, just stating it clearly, they do it in a really devious manner, which I find so evil. So let's just move on. I want to talk about the consultation. So according to their own rules, the government's own rules, there's a way to do consultations. And there's a document, which I have somewhere, and I'm going to try and find now. And it lays out that you sent a copy of it, so thank you very much for that. Here we go, consultation principles. And you can see it assets.publishing.service.gov.uk. And it says consultation principles in 2018, they should be clear and concise. So clear means speak plain English, concise, limit the number of questions to those that are absolutely necessary, make them easy to understand and easy to answer, avoid lengthy documents whenever possible, blah, blah, blah. And they should have a purpose, it should be informative, part of the process of, it shouldn't, are only part of a process of engagement, blah, 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 and, all this kind of stuff. And now, if you look at the actual consultation that we've got, it goes against everything they've just said. It's a 79-page document. So it's not concise. The questions they say in the document that, they've got, I think, 12 questions or something, but they're broken down. Let me just find the thing for you here. So if we go down here, give it the online survey. So it says, here we go. It wants personal information. We're not going to give any of that. Here, it says, we've got some questions of page 3 of 28. So it almost looks like there's only like 28 questions. But it's a lot more than that, isn't it, Melissa? Because then it's not just like 1 or 2. It suddenly starts becoming, B, C, and D, and E, and God knows what else. Am I right?
Well, it's 79 pages, but on that, there's also links to other documents that you would have to read. So it takes about 3 hours to read just that text, never mind all the other texts. It's 47 questions. The 2015
47.
consultation was something like, I think, 21 pages, 22 questions, which was a reasonable amount in 2015. So it doesn't meet the consultation principles, because anybody who's reading it, the feedback that I'm getting is what I don't understand. And it's such a lengthy, it took me about 3 days, to be honest, to read this, because my brain was trying to figure out what ear to crawl out of. It was so dense. And I'm educated to university level, so, I'm capable of reading this thing. The other thing with it is that it's presuming consent, and I spoke with you about this.
Yeah, explain that.
It's presuming that you consent to changes in the way we are governed. Right now we're governed with, not ruled over, so we will be ruled over in changes to the magistrates court and changes to the rule of law, accepting that in an emergency situation our human rights can be suspended. So we're accepting changes to the Good Friday Agreement where we were devolved. It's presuming consent to all of these. And the way I explain it is, it's like if I says to my children, okay, we're moving to live in Australia. So do you agree or disagree with taking our belongings? So now I've got them discussing whether to take our belongings or not. When the real issue is, hey, I don't want to move to Australia. And that's what they've done. It's called the Delphi technique. And it's to silo you into the answer that they want to get. at the end of it. So you agree or disagree in that, and then they keep on refining that to get to the answer. When the reality is, like the Australia analogy, I don't agree to go into Australia, so I don't want to talk about whether we take our belongings or not because I haven't agreed to this. This would require a referendum. This changes of this magnitude would require a referendum vote. So it should be absolutely abolished in every capacity. It should not be getting nowhere near. And I think our MLS should be calling for it to be abolished, that it shouldn't be put in front of them to start to dissect because it's not a meaningful consultation.
So I'm going to quickly go back to that consultation and the questions, the online survey. The actual policy document is 79 pages, like you said. It's 47 questions they go through. It's absolute BS. I'm a consultant orthopedic surgeon, university trained. I think I'm quite intelligent, and I was getting a headache. Right? I was getting a headache. It's designed in such a way that it's just. I remember as a surgeon, I was asked to provide patient information leaflets, and I wrote them, and it took a year, and it was so painful because it kept being sent back to me saying, "Oh, it has to be the reading age of a 9-year-old," and I was like, "You're asking me to dumb it down so much that it basically means nothing." I'm just writing gobbledygook, because how will they understand? Like a 9-year-old, like that's crazy, and I would keep it really simple, and they would just send it back to me. It's not simple enough. It's not simple enough. I was like, if I dilute it down any more, it won't mean anything. And what I'm trying, that was just a patient information leaflet. But when it comes to this major changes to our freedoms, it's all so technical and so confusing, and the word salad, it's deliberate. So let's just go through an example. And then I think what we should talk about is what should people do? People listening to this podcast, how should they act? Because I think there are things we can do, and we can stop this in its track if enough people get on board and help us. So let's go to this. So this is, do you agree, structure and purpose of the bill? Do you agree or disagree with the proposed statement of intent? Agreed. I think it's very simple. No, I don't agree. I don't believe the bill should be put forward. It's a complete violation of our freedoms. It should be, whatever. Just rejected outright.
I wouldn't hit agree, disagree, undecided, non-applicable, because that's moving you into accepting the primary. So for me, I would just be given a comment on that saying, I'm not willing to engage in the agree, disagree process because I have not agreed to the fundamentals changes that will be made.
Maybe even better, people don't even engage with this and rather simply email. So we're jumping forward a bit. I wanted to talk about all these individual questions and highlight how stupid they are. But maybe the answer is, there's an email, contact. Should we just email that phbt@health-ni.gov.uk?
Well, there's 3 things that I would recommend for people to do. 1, don't enter into the Delphi technique of agree or disagree. Put your comment that I cannot agree or I cannot enter into this. I do not consent. And then back that up as well with an email. And then on top of that, contact your MLA. Now, people are getting the generic response, but there's a change of tactic here. So instead of saying, I object, what are you doing about it? Say, I need your help filling in this consultation. It's not clear and concise. It doesn't meet the consultation principles, and they help people fill in PIPS forms. So why would they not help people? Because they're trying to just get the public to go away and forget about it. And I believe that they ended it because there is a 2-week news cycle now that there's so much happening in 2 weeks that used to take a year. It's like, another assassination attempt on Donald Trump. What's happening today? So they're hoping that it just goes away, and Mike Nesbitt is off with COVID. So
you can make it up.
I think this is going to be won by bringing it to the MLAs, because if you're constantly telling them it doesn't meet the consultation principles, and I do not consent to any of this, and I need your help to find out what to do with this form, that allows then for a case to be brought to court and pull it down based on it not meeting the consultation principles. And as you say, it's actually quite easy to explain to people. I mean, I could do it in a leaflet. And are you willing to give up all of the majority of your human rights? in order for the government to protect you? Are you willing to be criminalised if you don't accept this protection? Those two questions. Are you going to get anybody to vote yes?
Ask those questions
that
again.
Sums it up.
Repeat those two questions.
Are you willing to accept that the government can remove or suspend your human rights in order to offer you protection? So that's a yes or no. Are you willing to accept that you will be criminalised if you don't accept government protection in healthcare? 2 boxes. Answer those questions. Nobody's going to answer yes to those, and it would be absolutely put down. You don't even have to go in through, because the human rights would be encompassed in the changes that they're trying to make within the magistrates' court as well. And it is that simple. Nobody's going to agree to that. That's why they have to have this word soup, lengthy document, without giving any details. It doesn't even give the details of what the notifiable diseases are. So your doctor could be forced into snitching on you if you have the flu and didn't get your flu shot, or under the threat of a £5,000 fine. And like I say, what's omitted then from the document? It doesn't say that there has to be group benefit. The prophylactic can be for you personally. So now you're forced into taking something. Well, personally, I probably wouldn't take chemotherapy. I think that's my choice.
Yeah, me too.
Downsides to chemo. But that's my personal choice. So would it be okay then for the government to mandate it for my own care? Because that's no different than the vaccination that they're proposing here. So what they're trying to do here, the level of overreach is just blatant. And it's as if they never feel like they need to be voted in again. Whatever they expect to happen.
And once government takes power, it never relinquishes it. That's something that time and time again we've seen in history. So listen, I think there's 3 things here. People listening, a lot of my audience is from, Australia, New Zealand. Shout out to you people. I love you guys. You're freedom-loving people. The freedom-loving people in Canada and America. Look, they could email this phbt@health-ni.gov.uk, because they might be visiting, they might be studying, they might be working, they might be traveling, and they could just say this is draconian, this is an overreach, and this should be abolished, and it shouldn't even go to the MLA. They could do that. Then there's people in the UK who could do that because it affects them as well. Then there's the online survey, and the good thing about the online survey is you don't need to give your details. So if you look over here, it says optional when it comes to the name. Applicable. So postal address, optional. Postcode, optional. Email, optional. So you've got people all around the world who could be filling this form in, and you know what? It's all right. It's, you can help us, guys. Stop this from happening in Northern Ireland. All of you can go on the consultations #2.nidirect.gov.uk/DOH -1/public -health-bill-consultation/consultations blah on intro. It'll all be in the show notes and in my Substack. Everyone listening, and there's a lot of you, please just go on this and fill it in. Don't give your details, and don't, like Melissa just said, don't say you agree or disagree. Don't even tick the boxes. Melissa, just repeat again. What should they write now in this first box number 1?
I actually have done a video saying what I would write, but it would start along the lines of, I will not engage in the agree-disagree process. I do not consent to fundamental changes being proposed in this document. And then list, the changes to the magistrates' court, the changes to informed consent, along that lines. I have done a video on everything that I will be including in it. Plus, it's an attempt to incite harm in the people by removing informed consent. I mean, we know people will die. Yeah. So we're saying that it's acceptable that an amount of people will die by these mandates, by government mandates. So I would go along those lines and have a look at a couple of them, like the presumed consent, the government protectionism, it's concise. It doesn't say. Even it says other facilities. It's that you can be detained in hospital or other suitable facilities. What's that?
Exactly. So, but like what I'm trying to say is, do I need to answer every single thing in this box, or can I just leave the next ones? Like number 2, it says, do you agree or disagree with the
No,
definition
I
of
would.
infection? Can I just copy and
I
paste the
would
same answer?
You can copy and paste the same answer, or even that in itself is laborious. I would also include that it doesn't meet the consultation principles, consultation principles, particularly A and C.
This
and it's
doesn't
presuming my consent.
meet the consultation principles, in particular A
and C.
and C, right? And that's it. That's all I need to do. And then what? I just go fast forward to the end.
Yep, you can do that on every one, or you can just say, "And take this as my answer for all further questions," and then back that up with another email.
Love it. Take this as my answer for all your questions. Yeah? Okay, so the thing is, I mean, just look at some of these questions. I mean, it's ridiculous. So, hazards approach. Do you agree or disagree with the definition of infection and contaminations? You know, I mean, the definitions aren't in there. I mean, it's just nonsense.
They don't give a definition. So
exactly.
They want you to agree with something that they haven't given a definition of. It doesn't make sense.
Exactly. Again, this number 3 question, absolute joke. Number 4, do you agree or disagree that there's no requirement to replicate in the bill the provisions in the Health Security EU Exit Regulations 2021 in relation to it? So what, you now need to go and read this? Because you're like, well, what is this all about? I need to read this to understand. It's just nonsense. No. Moving on.
Why do we need monitoring and surveillance? Surveillance is coming up quite a lot.
Absolutely.
So is it about public health, or is it about moving us toward a surveillance state and accepting that?
Absolutely.
What I'll be doing next is pulling down Face Watch and this conditioning to accept facial recognition in order to buy a loaf of bread. That has to be taken down next.
Yeah.
Once, if we have to do this now. If we don't, people just accept it. So if you think of going through the airport, going through the machine at the airport, everybody just goes because the person in front went through it. And then when I don't go through it, people are like, oh, I didn't know that. I thought you had to. So that's why it's really important to let people know you don't have to. Everybody, it was the same with the masks. People were saying, you have to. No, you don't. You don't
apparently,
have to do anything.
Apparently in the EU, it's going to be like you have to. In the UK, you don't have to. You can still opt out. But I think in the EU...
This is why they want to legislate. When they legislate, then you have to.
Yeah. So, I mean, again, number 5, do you agree or disagree with the proposed all hazards approach? It doesn't even they don't even explain what all hazards mean. What does that even mean? How can I answer that? Do you agree or disagree with the duties to be placed on registered medical practitioners? No. What duties? No. What, you're going to just stop them from working and thinking like you've already done and make them force us to, to lock us up and do forced vaccinations? Evil. And it goes on and on. 7 is the same. A, B, C. It's all this rubbish, garbage. I mean, this goes against the consultation principles. Like you said, it was 2 questions. 2 questions to which the answers are simply, no, you're not allowed to do this to us. But they've created 47 questions with a lot of gobbledygook and garbage to bog us down and to make people think, oh, I can't be bothered doing this. Oh, just leave it. And that is tacit consent, I guess. Gives them permission to say, oh, well, see, no one engaged in the process. No one's got a problem with it. We can go ahead and do this. Am I right?
Absolutely. Acquiescence is consent.
Look, 19. Do you agree or disagree with the additional provisions in relation to the making of the magistrate? Basically, what they're saying is, do you agree that we can strip away traditional rule of law and impose these things on you? That's what they're asking.
Well, it's getting into the nitty. They're moving into the nitty gritty. So it's like me saying, well, the Australian analogy. So do you agree or disagree with take our belongings? Well, should we take the TV? Should we take the, so it's getting into the smaller things when it's, so you're getting bogged down and getting annoyed about that and concerned about that when you shouldn't be. It should be the overarching issue that you should say, I don't consent to that. So, I don't want to discuss this as I don't.
This is actually more than 47 questions because a lot of these are A, B, C, and D. I'm sorry, this is more than 47. I haven't done that full tally, but we're into 60, 70 by now, by the way. because many of them were like ABC. Do you know that? It's not actually just 47 questions. No, I don't want to give my email. Would you give an email address? Would you give an email address?
For me, I would.
Okay.
It depends. It depends on what. I mean, it's pertinent to me, and I'm already out there being very, very vocal about it. I think more people need to be vocal about it. I've said this before.
All right. I'm putting in my email address.
People think of them, and we really need to. I don't care what other people think of me. I care what I think of me. So anything that I'm posting on social media or talking about, I have looked at it, I have researched it, and I'm speaking the truth. And if people don't like me for that, I'm good with that. I like me that I can be vocal about it.
I've done it. I've submitted it.
See, it's that quick. The other thing is that it's important not to feel hopeless. There's a psychological manipulation against us. It's important to kind of think of it in terms of, if you're going against the wind, you don't hope that it gets weaker. You hope that you get stronger. So people really, this is not going to go away anytime soon. So we have to really get stronger. And I can't do everything. You can't do everything. Nobody can. But if we all do something, then we can achieve anything. So it's not about what you can do. Focus on what you can, or not what you can't do. People need to focus on what they can do. And this is an easy one to start attacking against what they're trying to shine a light on it, and contact your MLA and ask them to help you fill it out. I've also said that if they say no, they don't have time, and Miss Kathy Gray has had that response, and she's, how dare you? I pay you, you work for me. You can also offer them to come along, that you will hire out a room, 100, 200 people in it, and the MLA, in order to save them time at a time of their convenience, and the MLA can come along and explain everything about it. They're basically saying, oh, it's not got to us yet. Well, I'm sorry, but you are supposed to represent the people, and it's out for consultation and it's not clear. So you need to represent us in this. And I'd be very willing to go along if anybody's hosted that meeting with the MLAs. I would be very glad to go along and ask questions.
I just want to summarize. You sent me a note of all the stuff, and it's fantastic. I'm just reading off it, and I'm actually going to use this as a Substack, and I'll obviously acknowledge it's all your work. So, in summary, it's proposed that the new bill will be based on the all hazards approach in alignment with other UK jurisdictions for the protection of people from known or yet to be discovered hazards, infections, or contaminations, and that's literally word for word what they've actually written. Update certain powers around restrictions or on employment, quarantine, isolation, and medical examination. Clarify roles and responsibilities for different authorities, and provide underlying human rights-based principles, BS, under which powers of intervention would be exercised. And what they state is the aim and objective is to widen the scope of public health legislation to create permanent powers. Like I said, once they do this, they will never give it up. They will.
No, and you accept our human rights being suspended in the lockdown, and that creates a parity argument that in any emergency we will accept our human rights being suspended. We need to be very vocal about that we never agreed to it to begin with. The evidence is now out that we were scared into it. You remember Matt Hancock scared the pants off of them, that we were psychologically manipulated into that compliance, and that can never happen again. It's not sufficient to just say no. Now we have to redefine the parameters of their authority. We need to redefine the parameters of public health. If you've read that 79 pages, is there anything in that you've seen is a promotion of health?
No. What it means to be healthy, what it means to be physically and mentally healthy, there's nothing in there that helps with that. Nothing.
79 pages and not one thing that promotes health. You can't even see a GP right now. For 4 years, that's the gatekeeper. The GP is the gatekeeper to your healthcare, and you cannot see a GP. You get a window of opportunity of about 10 to 15 minutes to phone in the morning to get an appointment. If not, it's try again tomorrow. during the pandemic, the levels in Northern Ireland rose from roughly around 15,500 deaths per year up to over 17. We're still at those levels. Now, out of those deaths, the one that sticks out is April. There was 1,933 deaths, but the majority of those were in care homes. And as Chris Whitty has now said, it was protect the NHS, save lives. People were afraid to go to hospital. And that's why there was so many deaths as well. People were dying with heart attacks because they wouldn't go to hospital. People are still dying now, but nobody's asking questions about that. They're still at pandemic levels. How many more undiagnosed cancer treatments, heartbeat? How much more has to go undiagnosed before we start to look at promotion of health? And that's why they want to move us into this new Encompass program. They're saying about virtual. I think Robin Solon says about virtual clinics, so that you never get to see a doctor, and then you just get sicker and sicker and sicker.
Do you know what?
That's, for me, it's a good opportunity. We need to stop delegating away our healthcare and take back control of it ourselves.
And it's funny, it just hit me there. This is a bill about public health. For some reason in my head, I was like, oh, they're talking about like pandemics, infections and whatever. No, this is a 79-page bill about public health. And there's nothing in those 79 pages, like you've just said, that has anything to do about really health, about prevention of illness and disease and how to be healthy. Nothing. It's all about granting the government and the authority powers and stripping away our rights, and the powers are endless in scope, and there is no mention of the rights that we have to give up. I mean, they don't qualify. They give examples like, coming into your premises and whatnot and forced vaccinations, but there's no actual list. Hey, by the way, these are the rights that you'll be relinquishing and in return for all these powers that we're going to be getting. It's incredible. It's absolutely incredible. And so look, we've got the whole presumed consent business. And these entities, these devolved entities, they all then do a nod to the UN and the WHO and all their agendas, and they're driven by those people. It's fundamentally not democratic. It doesn't mean they meet the consultations principles, 1998. They've used this whole all hazards to circumvent the 1967 Act, which is exclusively about infectious diseases. By doing this all hazards, it's an expansion to, well, anything that can harm you, we're going to be here to protect you. What does hazards mean? Is it natural disaster? Is it terrorism? Is it cyber attacks? Is it power outages? Is it climate change? What is it? They don't tell us. And it's not consistent with even the World Health Organization regulations 2005. It's insane. It is absolutely insane. Is there cross-party consensus? Is there any like opposition to this in the MLA?
Carla Lockhart and Paul Frew are the only ones that I can think of. I think Diana Dodds as well has said. Well, Mike Nesbitt said that he's opposed to forced vaccination. Mike Nesbitt, whose name is in the front of the document, I don't know if he has read it or not, but he has actually come out. So it's what I think is the pandemic treaty failed on a macro level. So now that they know that, they've already had it in the works to get it in the micro level. So Australia, New Zealand, Canada, Scotland, now Northern Ireland. So if you bring it into Scotland, then for freedom of movement across the border, people working, well, then you're going to have to bring it down through the mainland. If you bring it into Northern Ireland, then with freedom of movement across the border, the South of Ireland is going to have to adopt similar policies. But even with North, you can also say that the UK mainland would have to adopt the same policies again for freedom of movement and with the Good Friday Agreement. So it's quite a clever way of getting it in and then bleeding it out instead of an overarching pandemic treaty. They're still trying to get this in to move into a one world government to match up with their one world currency, totalitarian control.
You sent me a document with 100 and 88, 109, like you went through every single point that they've mentioned in their 79-page document, and you've broken down how every single one of these points is wrong. You've even highlighted, for example, in 155, how the Public Health Authority can serve a notice to the head teacher, requiring them to provide a list of the names and addresses and contact numbers for the pupils who has recently, that person who is or has been recently been on the school's premises and may or may not be infected, contaminated. I mean, they're just getting them to, and if they don't go ahead and comply with their notice, they can be fined. The head teacher can be personally fined. I mean, it's just, the overreach is just incredible.
The bereaved can be fined if they don't meet the requirements of what they're supposed to do. If the body is contaminated.
So the Public Health Authority or other medical practitioner may serve on the person having charge or control of the premises in which the dead body is located a notice prohibiting any person from entering the room in which the dead body is located or having any contact with the dead body. This person must arrange for a copy of the notice to be conspicuously displayed at each of the entry points to the room without delay. Any person who commits an offence under this regulation is liable to summary conviction to a fine not exceeding £1,000. So if someone dies in your house, you need to start putting notices up on that door saying, dead body, don't enter. You can't say farewell to your mom or your papa or your grandpa. You have to put a notice outside your house. Dead body in here. What the hell?
It's horrific. Okay. My mum died during the first lockdown, and there was only 12 people allowed at the funeral, and nobody was allowed at the wake. And so you're not allowed the respect and the dignity in death that you should have. And a lot of people are now suffering because they didn't get to grieve properly at the time. At least I got to be with my mum when she died. So many people, you've heard the stories of people together for 40, 50 years, and they had to die alone. And we have to take a responsibility here. We allowed this. There was no jurisdiction. We got paid to go along with this. Now they're trying to legislate against this. So failures that aren't us from previous, it's time for us now to step up and go, no more. Now's our, we need to be brave, and we need to be vocal, and we need to be active. Or this, we will be, just think of the world that you're leaving behind for your child. Every medication has side effects. Like I say, penicillin's great, you wouldn't mandate it. So what happens when it's the next mandate? I've seen these people that have been injured. In fact, FIBS, which is Vaccine Injury and Bereaved Northern Ireland, have met with the First and Second Minister and have a meeting in the Long Gallery in Stormont on the 14th, the day that this is supposed to close. So these ministers have met with people who have been bereaved and injured from this vaccine, and yet they want to proceed with mandating it, knowing people will be injured and die. These people should be pulled out of their positions altogether for even suggesting this.
Absolutely. So, Melissa, you're right about the drugs as well. Look, the dose is in the poison, It's all about how much or something you're given. Every drug, pharmaceutical drug, is a poison because that's why they tell you not to take more than a certain amount. Every drug can be a poison. I've yet to see a vitamin that you can overdose on and kill you. But every pharmaceutical drug you can overdose. That's a fact. Listen, before we wrap up, I'm just going to read what you wrote. And you said, my personal response to this consultation is to not participate in the agree-disagree questions. I will not be ticking any boxes. Rather, my response will be as a comment to the first question and to also send an email to back it up. It will read as follows. I do not consent to this bill. I refute your authority to ask these questions, presuming that I have consented to a fundamental change in the relationship between the government and the people of Northern Ireland, where we are ruled over rather than governed with. Under what authority are you asking these questions that, as far as I can see, do not bear any relation to the glaring concerns in the proposal in terms of how it affects my human rights. It is not made clear at all what rights I will be giving up for this supposed protectionism. I see it as an attempt to incite possible harm against the people in the absence of informed consent, and a possible attempt to impose an all-hazards approach to surveillance where it does not define the parameters of the surveillance. It is not a meaningful consultation. It was difficult to find. No media attention, no promotion, merely sent out to a selected few. Therefore, I am not accepting the credibility of the consultation or its questions. They do not meet the consultation principles in terms of document length, in that it would take even the most highly educated at least 3 hours to get through, and presents as an intimidating read. The format is designed to give a rather restricted rather than an informed response. It is not clear if this potentially negates the Belfast Agreement in terms of devolved healthcare and borders. Implications have not been presented in any capacity, nor has a definitive list of notifiable diseases or the method of diagnosis, PCR or other, been provided. It has not been made clear to whom else authority can be given, or if the forced mandates of protection will be grounded in fact-based science or computer modelling, or all making an informed response impossible. The state overreach proposed in this document is a gross infringement on human rights and in direct contradiction to informed consent. The proposed changes to due process and the rule of law in magistrates' courts breaches Article 6, the right to appear in court, to hear, see and test the evidence, allowing then only the right to appeal, shifting the burden of proof, thus attempting to change the rules of the magistrates' court under the guise of public health. These changes present a constitutional issue that would require a referendum vote. Take this as my response to all further questions in this consultation. In short, I am challenging their authority to change the law and our fundamental relationships with the government without a public vote, and their adherence or lack thereof to consultation principles. Melissa, you are some incredible woman. God bless you. Seriously, God bless you. And all I would say to all those people listening is, please, if you love your family, you love your freedoms, you love your grandchildren, for God's sake, go to the show notes, read my Substack, fill in the consultation like we've advised, email and write to your local MLA and say, over our dead bodies. No, thank you. Help us with this consultation because we don't agree with it and we want you to throw it out. You know, this is not what we want. Melissa, is that a good summary?
Perfect. Yeah. Perfect.
Melissa, look, I traditionally have a question right at the end. I'm going to ask you, please, you probably answered it already in this, but look, if you were on your deathbed many years from now, surrounded by your loved ones, and you're about to meet your maker, before you pass on and meet your maker, what words of wisdom and advice would you pass to your loved ones?
Oh. I think that what I'm trying to do it while I'm still alive before my deathbed is to create the knowledge in them that freedom is not passed down in DNA. It has to be fought for, and it's constantly under attack. That would be the information that would need to become generational, in my opinion.
That's amazing. I've done 230 podcasts and no one's given that answer. Freedom is not in your DNA. It is something that needs to be passed down and fought for. You know, fought for and passed down every generation. Look, preserve your freedoms. Don't take it for granted. Yeah?
Yep.
Oh, Melissa, thank you so much.